Hello friends, welcome to my YouTube channels and hope you are all safe and doing well during this pandemic anyway. So today I'm uploading the videos basically from the pathology, and there's one of the important topic and the vital topic in pathology, that's called inflammation. That is called inflammation. That's inflammation. Now I'll focus here that what is inflammation, the types of inflammation, and their mechanisms, of course. So if you want to have the good concept, if you want to have the control idea about it regarding inflammations and the mechanisms, have to see the full video. Okay, hope you will just after watching the video you'll have a better concept than the previous. Okay. Okay, so today basically I'm just saying that inflammation. Okay, so inflammation means what, guys? Inflammation means anything induced or vascular connective tissues, and the tissue will respond against the invasions or whatever you can say the injured, the cause of injury, against the cause of injury by inflammation. So you can write it here. What that inflammation is? What it's okay, guys. Anything induce or vascular connective tissue is so anything injures or vascular connective tissue, then what? Then the tissue will respond against the cause of injury. Okay, then the tissue what? Then the tissue will respond against the cause of injury, the cause of injury, the cause of injury. So basically, in another terms, we can have also the definition in the shortest form. We can write in the terms of definitions. We can give the definitions here. That what is the response of vascular connective tissue? Is the response of vascular connective tissue towards injury? Okay, is the response of vascular connective tissue, towards injury, and regardless the cause of injury. Okay, so you can write regardless the cause of injury. That means what, guys? For suppose I'm just I got inflamed in this portions. Okay, there is the vascular connective tissue, and of course the injury may be by any cause, any types of the injury. It may be like physical trauma, it may be radiation, it may be chemically, or it may be microbial, invasions like the bacterial, fungus, all the things here. So whenever the so what the types of injury you can see here. So how can we get injured on tissue? It may be what, guys? It may be, what did I suggest right now, that physical trauma, it may be by radiation, it may be by there is like chemically, or I'm just giving some chemical substances that is getting the cause of, that is making the cause of getting injured in this place. Okay, so it may be chemically, many chemical substances anyway. It may be by the microbial invasions, by the microbial attacks. It may be by the microbial attacks. There are many more reasons, so I'm just giving a few of them. So microbial invasions. Okay, now so I can get injury by this many of the regions. More over this. Okay, anyway. Now, what's the main purpose of injury here? First of all, I got inflamed. I am having what, injury in this portion. So our body's defense system will try to make it what, neutral, or the body will try to remove the cause of injury from here. So these are the basically what the purpose of inflammations. Now, if I want to remove the cause of injury, then in our body defense system we know that what there are various type of the cellular cells like the WBC. That within the WBC we know the lymphocytes. There is what macrophages, many things are there. So those things will come here. And if you can have the more blood, if you can have the more amount of blood in these places, then we can have more cells. So if you want to, then if you want to have more amount of blood, then what, the in inflammation we should have what, more amount of blood in the injured place. So the purpose of inflammation here, what, there is one more point you have to know here, what the purpose of inflammations. First point we can say what, to bring more amount blood, to bring in the, to bring more blood in the area injured area. Then what, to bring more defense systems. That means what, by through the blood all the defense systems that are, those are present within the blood, they will come here, what, to bring more defense, to bring more defensive systems. Okay, then we can what, ultimately the, what is the main reason, to remove the cause of injury, or to neutralize the cause of injury, or to remove the dead cell, of course. And in the inflammation there are, we can see that the main dead cells are there after the reactions through by the action of the chemical mediators. And after that we can have what, through the inflammation we can what, through inflammation, or by the reaching of the what, those type of the defensive mechanisms, we can just remove all the types of the dead cells from there. So what, the another thing we can write, what, to remove the cause of injury, to remove the cause of injury. Then what, we can write, or to neutralize, you can write, to neutralize the cause of injury, to neutralize the cause of injury. Or you can write, to remove the dead cell, of course, to remove the dead cells from the injured place, dead cells from the area. So guys, I'm just saying here, so inflammation means what I said here, that inflammation anything by injuries that our vascular connectivity, so any, regardless the cause of injury, our body will try to what, our body, the connectivity, vascular connectivity, so will try to fight against it by the process of inflammations. Okay, so the inflammations, there is types of injury here, and the purpose of inflammation I just said here. You can have a look here now. So basically we know that in case of inflammation, okay, I'll go through the next page here. What guys, that whenever we are getting any person inflamed, at the time, what, at the time we will see there's the 5 main things here. We'll see what, first portion, there is pain, then we'll get what, we'll see redness, then we'll see, okay, hot, and we'll see swollen, we'll get this like edematous, something like this, and we'll get what, dysfunction. Okay, now you know it only that we can say in these things in another terms, what, we just say in the pain in terms of dolor, we say the redness as rubor, you can say, we say the hot in this terms of calor, and the swollen portion we just say tumor. Remember guys, this tumor means not like the benign tumors, that's by the process of neoplasms, neoplastic cells, there is like another thing, okay, like the benign tumors, the malignant tumors, those are other things, but it's normal by cause of injury, that's for normal inflammation, there is what, another tumor. And dysfunction, that we can say dysphasia, dysfunctionalia, okay. Okay, guys. Now we have to know what are the main things here in the terms of what inflammation. So basically, guys, you have to know there are inflammation is basically two types. I just said all the things here. Just what those are the things basically in case of general inflammation. Now inflammation are basically two types. Inflammation basically two types. One is acute inflammation. One is acute inflammation. Another is chronic inflammation. Chronic inflammation. Okay. Now this acute inflammation, this is very rapid action and short-lived. Very rapid action and short-lived. That means they will just work. After that, there will be no existence of it. Short-lived. What about this chronic inflammation? And chronic inflammation is long-term action. Okay, it's long-term action. There is for long-lived. And now we have to know basically in the acute inflammation. For suppose if I get injured to any place of our body, if I get injury in any part of our body, for suppose in this person I got injury. Okay, for suppose I got injury in these portions. You know, take it as a cells ahead. Just assume these cells. By any means of cause of injury, if I just get inflamed in this portion, that what? There is our blood vessels. Through the blood vessels, there are endothelial cells. Through the endothelial cells, there are various types. Those things. The defensive systems will come here. Basically, the neutrophils. Here. The neutrophils those will come. We're having complementary system. Many things will come here. I'll just go in details after just finishing this video. In the upcoming videos you will just come to know all the things here step by step. So next of all we are having the chronic inflammation. It is the long term actions. Okay, it's the long term action, and there basically first suppose same thing, but here we'll just get various types of the actions of various types of the cells like the fibroblasts. Okay, I'll just say all the things step by step. Many things are here also. I'll say step by step. Our main focus acute inflammation. Now now in acute inflammation, okay, in acute inflammation there are two events we can say. One is cellular event and another is vascular event. So first one, if we just consider it as vascular event, and another is there is like cellular event. It was used to said before that is WBC event or something like this, but after that we came to know that not only WBC but also many cells are there. They are involved here like the endothelial cells. Many cells are there. So now we just say it's in common terms that is the cellular event here. And now we'll focus the vascular event. To understand the vascular event, I'm just taking first suppose in this person I got injured. Now this the tissue of these portions, I'm just taking a small piece of the tissue. I'm just focusing here in the broadly. Okay, here in the phases. Now the tissue. Okay. Now I see it clearly. Suppose guys it's or tissue. Okay guys, and it only that first suppose there is within that tissue there should be what parenchymal cells. First of all these are the parenchymal cells. Take it as the parenchymal cells. And of course you should have idea also, of course, what is parenchymal cells. Parenchymal cells are the specific cell in this, in the they just do like the function of the, like, for suppose if you say the parenchymal cell in nervous system, the parenchymal cell in nervous system will be neuron. Okay, the parenchymal cell in the liver will be hepatocytes, like this. The parenchymal cell in the, skin, there will be dermis, epidermis cells. Okay, many things are there. Like this, you have to know that many things. What the there is like parenchymal cells. Along with them, there will be some stromal cells, and of course, just take it like as stromal cells. Stromal cell. Now, guys, first suppose, and of course, I got any bacterial infection. These are like pathogens. They're coming here and they're just what? They are invading our tissues. Like what? These are the parenchymal cells and these are the your stromal cells. Stromal cells means, guys, the cells which support the main cells. For suppose if I just talk about in the nervous system, then in nervous system the neuron, the neuron, that is this parenchymal cells. But the neurons, they are supported. They are being supported by the neuroglial cells, right? You know that only. So here the neuroglial cells, they will be what as? They will be as what? The stromal cells. Now first suppose whenever this like the bacteria they have, or whatever it is, the pathogens, they have come here, they are going to invade the cells. Okay, so the cells like this, the cells, the stromal cells and the parenchymal cells. Now for suppose just take it here. So one of the most important thing, another, just forgot to say you that whenever whenever there will be inflammation, and if I want to have the more amount of blood, if I want to have more amount of blood in the injured area, of course there should be vasodilation. Otherwise you cannot have that much amount of blood to just cure the area. Okay, so one of the main condition here, that there should be the vasodilation on the nearest part of the injury, the nearest place of the injury. So take it as like the normal blood vessels. Okay, and through the arteries, another artery that is going here. Okay, guys, now you know it only within the word. There are in the arteries there are smooth muscles. The circular smooth muscle is it. Outside also the smooth muscles. Take it as smooth muscles. Now whenever we'll just see here, first suppose these are the cells, okay, the parenchymal cells, and I'm just considering these are the cells, like the way I'm taking it as like mast cell. Okay, these are taking mast cell. This is taking like the resident lymphocyte, and I'm taking it as macrophage. You know it only, all the cells should be everywhere. So of course you have to know about the mast cell. Mast cell is one of the most important here, because you have to know all the things regarding mast cells. Those will help to continue the process of inflammation here. Now the mast cell is here, that mast cell is located in many places. Okay, mostly the mast cell is especially located in the where they just locate around the blood vessels, around the nerves. Okay, we can say what, around the blood vessels, nerves. Okay, especially here, but they are present on all over the body. And of course where external lining, external body lining, of course internal body lining. Okay, now guys, so whenever first of all any bacteria and any pathogen is coming here and they are just invading our body cells here, at the time in the membrane, within the membrane of the stromal cells, and in the stromal cell and the parenchymal cell, there are some enzymes, and those enzymes will form what they just first produce. Whenever they will just understand there's something is wrong here, they will produce what, the prostaglandin. First they will produce what, prostaglandin, prostaglandin, or you can write PGE. Okay, Now guys, they will form what? The prostaglandin here. Not only prostaglandin, they will form many things here, okay? So what they will form, first of all, I'm just, if I talk about normally about the mast cell here, mast cell, okay? Then they will form what? They will form here leukotrienes, the leukotrienes. They will form platelet activating factors. They will form what? Tumor necrosis factor. They will form cytokines. They will make cytokines here, okay? And of course they will just preform histamine. Many things are here. Now guys, you have to know that what they are doing here, okay? What they are doing here. Now first of all, if I just talk about, there are many cells, okay? Now just see here, one more thing they will produce here, that is PGE2, prostaglandin E2. They also can make, there is like histamine, I said histamine, there is what? NO, nitric oxide. Now the PGE2 and PGE2NO, and we can see here from here the what? The histamine, okay? The histamine. These three things, they will go where? They are having the receptors on the smooth muscle. They are having this receptors on the smooth muscles. Now they do have the receptors here. They do have the receptors here, and you know all the things that NO, PGE2 and what? NO, PGE2 and the histamines. All of them what? All of them are the vasodilator. They will go vasodilator, and whenever they will go there, they will just what? They will just to relax the smooth muscles here, and whenever they will come into the relaxed condition, of course there will be vasodilations, and more amount of the blood will pass through it. More amount of the blood will pass through it. And of course we are having what? The tight junction with the endothelial cells. There is what? Endothelial cells. Okay. Now we have to know one more thing here, that to maintain the blood flow within the blood vessel, they were having stalling forces. We know that we are having stalling forces, that what basically we are having hydrostatic pressure, and colloid osmotic pressure. Colloid osmotic. Now guys, in normal condition, first suppose the normal blood circulation is going on there. Now what will happen here? We have to know from here, okay? First suppose if there is like normal blood circulation, then what? First suppose there is the hydrostatic blood, the hydrostatic pressure here will be near about 35 mmHg, just take it, and the hydrostatic pressure will just at first it will be too much, and after that it will just get decreased. But the colloid osmotic pressure, that is constant everywhere. That is constant. So it is like, take it as like osmotic pressure and take it as hydrostatic pressure in normal condition, guys. Now what is the function of the hydrostatic pressure? They will push the hydrostatic, by the process of the hydrostatic pressure, they will push the what? Blood flow through the endothelial cells. They will push the blood flow through it, okay? Little amount. Now by pushing the blood flow through it, along with the blood, all types of nutrients, the nutrients, the oxygen, those will come out here, okay? Those will come out here, and again whenever these things are giving here, all the things, after that those fluids, those are coming by the process, by the action of the hydrostatic pressure, all the fluids will be taken again through the what? In the blood vessel by the what? Osmotic pressure. So pulling up, what is the function of the osmotic pressure? To take in again all the blood flow or all the fluids within them again. Now of course then we can say there is no, in the intercellular fluid there is no change in their volume, because of how much fluid is coming extracellularly, all the fluids, how much fluid is coming by the process, by the action of the what? Hydrostatic pressure outside, all the fluids again are taken up by whom? The there is like osmotic pressure. Now osmotic pressure, okay? Now what in case of the inflammation, what is happening in case of inflammation? You have to know, was there something wrong? There should be some abnormal thing, of course, that's why it's inflammation. And in normal condition, guys, that's it's happening. But in terms of whenever we are having what inflammation, at the time the hydrostatic pressure may be up to 65. Hydrostatic pressure may be 65, you know, and the osmotic pressure that will get decreased. That will get decreased. Just take it as like, sorry for it, but it will constant, but it will get decreased. And now whenever the hydrostatic pressure is getting increased here, so they will push the more amount of blood. So by the process of what, the more amount of blood will come out here, more amount of blood will come out in the extracellular, within the injured place. For suppose I am getting injury in this cells, so the more amount of blood will come, leukocyte, neutrophil, whatever are the mechanisms, they will come here. The chemical mediators will come here to rescue it. Okay, guys. Then one more thing, you have to know, there are some in this the endothelial cells. In these endothelial cells, there are some, there are receptors for the histamine. That is receptor for histamine. So by the process of histamines, there will be shrinkage in the endothelial cells. For suppose the endothelial cells will be like this. There will be the shrinkage within the endothelial cells in case of inflammation. So whenever there will be like the shrinkage in between the endothelial cells, so more amount of what blood will come out, or more amount of the other things, the chemical mediators will come out. So there will be endothelial gaps because they are having what, the histamine. There are receptor for histamine, and histamine is having the such capacity to make it shrink. So there will be endothelial gaps, so more amount of the blood flow will come out through it. Now guys, that you have to know one more thing here, that the gap, whenever we are getting inflamed, the gap in between the hydrostatic pressure and what osmotic pressure is too much. So what will happen, more amount of the blood flow will come out here. More amount of blood flow will come out here. Now through the gaps what, the protein rich fluid, there is also chance, the protein rich fluid, those will come out, and that is called exudates. You have to know these things. Listen guys, in case of you have to know that in case of inflammations, what, as we are having the too much difference in between the hydrostatic pressure and the osmotic pressure, osmotic pressure, what will happen there? Then there will be shrinkage, of course. So too much what, exudate means what, the protein rich fluid, within the plasma, the protein rich fluid that is coming out. So what, by the process of inflammation, so this is called exudate. And one more term you have to remember also, that transudate means for suppose there is no inflammation by any reasons, by any cause, what, the hydrostatic pressure is getting increased, then osmotic pressure is getting decreased, but there will be no gap within the endothelial cells. Because what, there is no inflammation, there is normal process is occurring there. So what will happen here, there is first of all imbalance or the difference in between the hydrostatic pressure and the osmotic pressure, but not by the process of inflammation, just normally. Then what will happen, the protein rich fluid will come out, but less, because there will be a tight junction in between the endothelial cells. So very less amount of the fluid will come out. So that is called transudate. So you have to know here what is transudate and what is exudate. I am repeating again. Transudate means what, for there is no inflammation there. Yet if there is the difference in between the hydrostatic pressure and osmotic pressure, but for it, what, the protein rich fluid will come out through the endothelial cells, but in very little amount, that is called transudate. But if we just talk about the exudate, then what will happen, by the process of inflammation, the more amount of the protein rich fluid will come out, because there is shrinkage in between the endothelial cells. So of course, for the shrinkage of them, there will be a gap in between them, so it will be easier for them to just come out. So guys, it was one of the very short video for the inflammation processes, and then of course, and I will upload the next videos stage by stage. There is like the more steps, the cellular events. Okay, this is the normal mechanisms for the hydrostatic pressure and the osmotic pressure here. It is very important, guys, and hope you have understood. And if you just like the video, then please just to subscribe my channels, and just tell me in the comment sections what type of the video do you want regarding your career, regarding your study, or whatever you want. You have just let me know about it, that what type of the video do you want, and just take a view here. You can take the screenshot from here. Okay guys, and if you don't understand anything in my handwriting or whatever it is, because my handwriting is not that much good, if you don't get any points, so just let me know in the comment section. I'll try to help my I'll try my level best to help you if you face any problem in the regarding my teaching here. So guys, I just said only the vascular events. Now there are many things I have to say. Guys, okay, you understood, I think. And if you don't get, you will let me know. Please let me know, and to subscribe please my channels. And have a good day. And just see you soon, guys. Just stay safe and stay healthy.